About the knee. So a lot of people have knee issues, and it's super important to assess the knee. The knee is a hinge joint, so it flexes and extends. A lot of people don't know it also rotates. It rotates in and it rotates out. When I start to look at individuals with knee issues and I look at their rotation, it's practically non-existent, or it's there but they're moving from the ankle, they don't have good control, or they're moving from the hip. So we really want to start to look at this. So to assess your own rotation of the knee, look at your shin and come up high to this little protuberance, this bony prominence that sits right below the patella. This is the tibial tuberosity. So this is that joint that goes to the femur. So what you want to do is bring that ankle up into dorsiflexion. So you're contracting the ankle, and you want to put tension through the ankle. So you want to lock the ankle out so that you can move that protuberance out and you can move that protuberance in. Now, if you are unlocked with the ankle, that bony prominence will not move. It just sits in place. So you want to be able to contract the ankle, put tension through the calves and the shin, and you want to be able to bring that out and be able to bring that in. If you're having a really hard time with that, you can plant that foot down and drive the hip out. So you're turning the foot in, hips driving out. That will help you find internal rotation. Now, if you bring the ankle out, the foot out, and bring the hip in, that will help you find external rotation. Now, this just puts a little bit of tension and torque. That just helps you find it. I like to, I prefer to grab a band and put it to either the outside or the inside of the foot, and then bring that band out, take tension through the band, and dorsiflex the ankle again so you can pivot off the heel, or you can put the foot flat on the ground and work through it this way. So just like we did before, but the band will help cue you and bring you into that internal rotation, and then you'll have to resist to bring it to external rotation. So once you're there and you find those with some of that resistance, and maybe you don't want to start with load just quite yet, this is just a little bit of a cue, so you don't really want to have to move through and put stress or strain on the knee until you start to feel that rotation. Now, once you find that and you can adequately move through that, and you can take the band away, then you can start to couple that and turn it into a controlled articular rotation, which is simply coupling that rotation with flexion and extension. So you're going to do that in a very controlled manner. You're going to externally rotate, you're going to extend all the way out, you're going to internally rotate and flex all the way in. External, out, internal, in. And this is a closed chain position, so you can also kind of block yourself out and do this open chain, however you would like to do this movement. But you also want to block the hip as well, because if you internally rotate and the hip's coming in, or you externally rotate and the hip's coming out, you're just compensating a little bit more. So you want to grab tension through the knee, and you want to be able to adequately move through this position. And then on the other side, you're going to internally rotate, go out, extend, externally rotate, bring it into flexion. So internal, out, external, in. Rotate in, out, rotate out, in. And then you can keep that position and go back the other way. Then you'll start to really work and utilize the knee more than you probably ever have before, and this will help you build better movement, control, capacity, and get you those prerequisites that you need for squatting, jumping, running, whatever you need. So that's how you build better rotation through the knee, so you can get more flexion and extension, and that's it. So I wanted to thank you guys for watching. I'll check you guys on the next one.